Hi, everyone. It's Stephanie with The Patient Story, and I am so happy to introduce our guest for today, Sara, who's here to share her ovarian cancer story with us and so much more. Sara, welcome.
Hi, welcome. Thank you.
So appreciative of you taking the time to join us. And I like to kick these things off because, as we know, this is about the cancer experience, but it's just a part of who we are, or what we've gone through, even. So tell us a little bit about Sara outside of that context.
All right. So I'm 36 years old now, and I love activities, physical activities, outdoor activities. I have been a nurse for over 15 years, and I've always taken care of people. My family is very, very important. I love to travel. I feel like everybody says those things, but I do. I'm in the gym at least 5 days a week. Snowboarding. I skipped a couple of years and impressed myself with actually not face planting completely this past year. So I don't know, just anything that's new and adventures, I'm completely down for it. Skydiving, traveling, hiking, climbing mountains, whatever is going to kind of be a new adventure for that day. I'm in for it.
You're adrenaline junkie a little bit.
Yes, I am to an extent. To an extent.
To an extent. Awesome. Yeah, I know it gives us perspective too, as you kind of go through what you went through after the diagnosis, that your personality's been like, you're strong. You described in your story when we were emailing, that, you're the strong one in the family, right? This is
Yes.
just, that's like been your reputation, and your role. So let's dive into this, which I know it happened over the last couple of years and a lot happened. So what was it that first got you to understand, okay, something's not right here?
So I actually I'm a nurse, and so there a while, it's probably about a couple years ago, I'd had random sharp pains, and I didn't kind of we tried to figure out what they were and we couldn't figure it out. My mom had breast cancer, so I'd always veered away from hormonal birth controls just for that reason. And also because I just didn't feel right on them. So eventually I ended up going with an IUD, and so I got an IUD placed, and then they do a 1 month follow up ultrasound. And so they did that follow up ultrasound and saw a cyst on there. And so my doctor was like, okay, there's a cyst. It's a decent size. Let's monitor it and see, because I wasn't really having symptoms. And so we followed it up 6 months later. Things were fine. My CA 125 was still like normal, but on the higher side. So we followed it up 6 months later. Everything's fine. And then at my 1 year mark, she had done another ultrasound and had some concerns that it had changed. And in hindsight now, I'm like, if I had known more of what the ovarian cancer symptoms were, I may have been like, okay, yeah, I have had some bloating, or I have had some like unusual things as far as that goes, but I was completely unaware of any of the symptoms. So I kind of went in with the fact that I didn't have really any symptoms of anything. I did end up having to meet with a gynecology oncologist for surgery. And he was more concerned. And I think I still was very oblivious to the fact that I'm like, this is a cyst. There's no way that this is cancer. He's telling me all about all the the surgery, the hysterectomy, all this and that. And I'm like, we're having a cyst removed. I'm like going back to work in 3 days. It's going to be laparoscopic. So I feel like I went in pretty optimistic. Probably about 4 minutes after I got to pre-op, when they did a urine pregnancy test, and it came back positive, that I was like, that's not good. So they had to do some blood work, and they kind of were trying to convince me that I was pregnant, and I knew very well that there was zero chance of being pregnant. So I knew that that's not a good sign. You don't have a
Mm,
positive pregnancy test. A tumor can cause a positive kind of pregnancy test, but just nothing, not being pregnant, can do that. So
wow.
that's when I kind of started having like the, oh no, this is not good situation.
Yeah, right. I mean, because going back to that time frame, first of all, you were what, like 33 or
34.
34? You're
Mhm.
34, super healthy, fit. How would cancer, ovarian
Right.
cancer, even pop up in your head, right? And so it's this gradual sort of sinking in feeling of, oh, wait, what's going on here? So what happened next for you in terms of, what the doctors were saying? What would have to happen?
So I was gonna have the cyst removed. So we had talked, my doctor and I talked at length on what the plan was. And I had to go into it positive. I knew that I had to go into it with my head on straight. So I had told my doctor, we're going to go in, we're going to remove like the right ovary, we're going to do the cyst, and then we'll make a plan from there. I was not willing to sign consent to have a hysterectomy. I was like, I wanted kids still. I hadn't had kids. So I was very much like trying to control what I could control of it. And he was very much like trying to lay out the facts of things. So we went in, like he finally said, okay, we'll do surgery, because he was still concerned about this pregnancy test. And so we did the surgery, and I think I didn't go into OR until it was July 3rd, and it was like late at night. We didn't go in until like 3 o'clock at night, because they had to wait for him to come out and talk to me and everything, and he was in the OR. So we went in, and I was in there until about 9, 10 o'clock at night that night. So I ended up coming out of the OR and was immediately admitted, just because it was a long surgery, and I stayed in the OR for so long. And then we also didn't really know what was going on at that point. I knew at that point, I woke up and I just had some small, tiny laparoscopic incisions. So I kind of was like, is this still a cyst, or we don't know? And then when I was in the wake up recovery room waiting to go to my room, I heard the PACU nurse kind of call report up to the floor and said, like, I have a 34-year-old female with metastatic ovarian cancer. And so now I'm like completely out of it, have no idea what's going on. And I'm the only person in there. Like it's 9, 10 o'clock at night in a recovery room. There's nobody there. It's me and him. I'm sure he didn't want to be there, but that's when I kind of was like, oh, this is why we are staying the night. This is why we are not going home. He just closed up surgery after taking out that cyst and kind of said we would have to talk about it. So I ended up getting admitted. And then my family was still all there. We went to the room. I kind of broke down a little bit and was like, it's cancer, it's cancer, it's cancer. And so no one really knew, because I told my doctor he wasn't allowed to tell my family until he told me, because I was the medical one and they don't understand. So they didn't know anything. Like they hadn't heard nothing. So they weren't even prepared for me coming out of OR to start telling them that I had cancer. They weren't expecting that either, because I hadn't talked to anybody. I just heard. And so then my doctor came in the next morning and he said, we have to kind of make a decision. We have to wait and see what kind of it is cancer. We need to see, he's like, if it comes back as this kind of ovarian cancer, we can just do chemo and stay the course. If it comes back as this, then we have to go in back for more surgery. So we just had a waiting game at that point.
The wait, by the way, whether it's for a scan or for a test or whatever pathology, any guidance for people on how to get through the hours, the minutes, the days?
I would have to say, as far as like the whole beginning stages, just do what you need to do. I honestly, once he came back in, so on July 4th is when I found out it was a cancer. And then at that point, they'd done a lot of work with my bladder, and I couldn't pee. I had to get a Foley catheter put in. My electrolytes were all off. I was like a disaster on July 4th. So I was very much not myself. I was just like, I wanted out of there and I wanted to like escape. And I honestly wouldn't have changed anything as far as like my own I let myself do what I wanted to do. And if I wanted to do this, I was like, I'm going to go for a walk. I'm going to do whatever. My big thing was I needed to get out of my room. I needed to get out of that hospital room. So we had a big courtyard in the hospital that I was able to go to for a long time. And I honestly spent probably the entire July 4th. Once I'm like out there with my Foley catheter, hanging out, not caring, because I did not want to, kind of spend any time in that room. I had lots of visitors come in throughout that helped a lot, which honestly, I'm so devastated for COVID, for the people that are going through this right now, because I had tons of visitors come in and out. I was still on a full liquid diet for many more days. And then on July 5th, my doctor came in and was like, we're going to keep you, we don't know what's going on, so we're going to have you stop eating. I'll come in and I'll talk to you about things. He came in finally at like 5 p.m. and told me that I had clear cell ovarian cancer, high grade. And that's when I just straight broke. I honestly, my family, I'm one of like the rocks in the family. I'm the medical one. I know what's going on for the most part. I'm the one that's going to support the family. But I broke. I completely like lost my mind. I like ripped off my shirt that I had on. I was down to like a bra and like shorts and like just basically screaming, crying, and like just, it's kind of funny now, because at the time I never wanted to put myself back in that spot, because it was when I just broke. My whole family watched me. My whole family didn't know what to do. No one knew what to do with me. I was a complete like irrational. I like didn't want anyone touching me. Like my cousin had been there for just visiting, and he's like getting ice packs from the nurse because I was like sweating. I was so hot. And I was like, so finally, like I kind of like almost was like, okay, like I just needed out of that room. So like I went and found like my nurse assistant. I was like, you need to dump this Foley out. I need to go for a walk. I need to get out of here. So I like just randomly like wandered the hospital at that point.
Mhm.
And I just needed out of there. And then soon after that, I found my doctor in the hallway, and I was like, you need to give me the pathology report. I need to see my name on that piece of paper that it says that. I was very much like, this is still not happening. And I honestly still to this day, he gives me every single lab work. I'm like, I need it all. So I feel like some of the things that, you know, you have to do for yourself, you have to do that'll make you feel better. And not that I want to say it's gotten easier now, but there in the beginning, I'm like, I want every single piece of paper, every single thing that has my name on it, my lab work. I want to know what they're doing. If you're giving me blood, if you're giving me this, if you're giving me electrolytes, I want to see why. And
Right.
half the time I didn't read any of it. Half the time I just put it in a folder. I have a folder with full of lab work, and I just I don't know what I'm going to do with it at any point, but I needed to have it. And my doctor just kind of let me do that, which
Yeah.
was weird. I'm very thankful for that.
I'm glad you're talking about that detail, Sarah, because, self-advocacy appears in many different forms. For you, you needed to see the evidence, the proof, the papers, right?
Right.
And you weren't afraid to ask for them. I mean, I think sometimes patients are a little bit like, okay, I'm just going to do whatever the doctor, I mean, if they don't give me this, I'm not going to ask for it. But and maybe your medical background helps in this, I'm not sure, but
Mhm.
it's great guidance for other people, right? Don't be afraid
And
to
I
ask
feel
for, yeah.
Yeah, and I feel like it's important as well to have like that information to understand like there's times that like even like I mean in the hospital I was a little bit just letting whatever happen because I was very much confused by the whole situation and overwhelmed. But when it came time for like chemo, like I would get my lab work and I would see like okay, your counts are really low, so you need to be more careful. And not that I wasn't listening to my doctors, but like me having the medical background, I'm like, ooh, we are really low this time. Like we need to be real careful. And my doctor was very like kind of easygoing. He's like, just don't be stupid. Is mainly his things would be like, just don't be dumb. Keep your washing your hands. Don't touch people that are sick. Like, at work, wear a mask, kind of thing. And so like, I mean, I've been wearing the mask since back in 2019, and so like I'm like over the mask at this point. But like even like my nephews, like I wouldn't kiss them on the face. So he was very much like still live your life and do those things. And but when it came to like even like my electrolytes, I'm like, okay, you know, I'm doing better here, there, or like, what I'm drinking. He was like, please don't go home and do what you did in the hospital and drink just straight water. And because I drank like 5 liters of water a day at the hospital because I wasn't eating, and then my electrolytes were complete crap. So I knew during chemo, I'm like, okay, I need to have some kind of, electrolytes or a smoothie. And so my whole thing was I need to control something. And I feel that that's very important is to find something to control. And it does not matter what it is.
Mhm.
I had to control, I worked Monday, Tuesday, Wednesday during chemo. I did chemo every single week. So I worked the first 3 days and then I would work out and I had control of when I did these things. And then like everything else was like up in the air.
Right.
So my control was what I like, I'm going to make sure I'm eating as healthy as I can when I want to. So I did make sure that I had certain things in my house. And then working out was a big thing for me where I'm like, I have control of what I do. It's this hour of mine that
Mhm.
I can go do whatever I want. I don't have to, no one's going to tell me how long to be here. No one's going to tell me
Right.
what to do. No one's going to tell me how to do it. I can do whatever I want. And if it's just riding a bike for 15 minutes, I'm riding a bike for 15 minutes. So I very much think that there's something that you need to control because you're not going to control your schedule. You're not going to control when you're going back to the doctor. You're not going to control your
Right.
medications.
Right.
You lose complete control of everything that you have in life.
Right.
And it's very overwhelming and it's
Yeah.
very fast. It happens like 1 minute you're like have control and the next minute, like literally like July 3rd, I was going into the hospital totally fine. July 4th, I have a Foley catheter and I'm getting IV replacements and I have cancer. Like
I
it's
know, it's crazy just how
within like
quickly.
12 hours.
Right, right, it turns, and I remember when I was going through it too, I felt like, "Oh, the lesson I'm learning is control's an illusion," because it was just like from one thing to another. I just have 2 more questions for this segment before we shift into the debulking surgery and the chemo, and the treatment. So, talking about control, one is sort of like narrative or breaking the news of your cancer, whether it's to your loved ones, and from what I gather, a lot of them were with you, but how did you go about deciding how to tell people in your life, or did you decide I'm not going to?
I kind of like I had a very close group of friends. My family was all there. My family, A lot of my friends knew I was going in for this like cyst removal kind of thing, so they were aware of that. I didn't really tell many people about it just because I didn't know. I didn't want to be like, okay, I'm having like an ovarian cyst removed. I need attention. I'm very much someone that's very independent, so I didn't want to go there with people. Once I found out that it was cancer, I started to tell some people. Obviously, like my family, just kind of it trickled down through them. I started telling some people, and after I had my major debulking surgery, one of my best friends started a GoFundMe actually for me, kind of thing, because I live alone and I have single income and I was going to be out of work, and this was just we didn't know. So she kind of typed up a story, and it got out really fast through that way. Um, I ended up having a blog at one point, kind of just to take it away from my Facebook. I again go back to the whole fact of control and the fact that I didn't want cancer to be just everything at that point. I was still trying to be in denial as well. So I made kind of where my Facebook stayed me, and I would randomly have some ovarian cancer in there. And then I would just leave the blog to over here because my family's not medical. And so they would say something to me, like doctors would say stuff to me, and then I would have to explain it to my family. And then it's like, okay, now I'm just going through it over and over again, multiple times. So I ended up kind of being like, okay, this is where I can put things and they can look there. My mom would try to kind of do some things, and then I'm like, just send anyone there. Just like everybody goes there. I'm like, they can read there, they can see there, they can follow there. So it kind of did. I feel like I had so much like kind of love and support, and it was great, but it was also so overwhelming where everybody wanted to know how I was. And I was like, I actually don't know how I
Right.
am. So
I can answer that.
yeah. And so it ended up being nice that I had a couple, my best friend, Courtney, she was very helpful with kind of going through, this group of friends, just trying to kind of keep them in the loop. And then like, my brother was great and my mom was great. And like, there's so many people that just were great to take kind of pods of people and kind of keep them informed,
Right.
where like, it just kind of trickled down. And eventually, I don't even know if I eventually just like blurted it out on Facebook and kind of said it, or if it just got to enough people. And
Right.
that's how it, because it was a weird kind of time frame, especially since we didn't think I was having surgery, and then like everyone's like, oh, you had surgery, oh my god, you have cancer, when did this all happen? And I kind of was like, well, I didn't think it was cancer either, so I didn't want
Yeah.
to bring that attention ahead of time.
Right. Right. It happened overnight, people. Like it wasn't
Yeah,
planned
and I was super
here.
healthy, so like everybody was completely blindsided as well.
Right.
They're like, no
Right.
way, like she works out 6 days a week, she's super healthy, like
How did this
no.
happen? I know
Yeah.
it's nuts. My last question for this is second opinion. Like, I mean, I know you went in. Was this a hospital just close to you? And did you consider getting a second opinion?
I did not consider getting a second opinion. I go through Carvano's Cancer Institute in Detroit, and it's basically connected to the hospital that I work at. I work in the pediatrics and across the courtyard that I spent my entire like time that I was in the hospital. So it was actually funny that I was basically walking around with a Foley catheter in front of my colleagues, kind of thing. So I would walk there. So it just was the first place that, I knew that I'd gone there for like my mammograms and all that stuff, because I started getting mammograms so young because of my mom. So I kind of had a little field there. My OBGYN kind of recommended them, and then someone else recommended them kind of in the beginning when we were just trying to look for someone.
Mhm.
He encouraged me to get a second opinion. He said, if you want to get a second opinion, go for getting a second opinion. My only other second opinion would have been through like a main hospital. And I honestly think having a cancer center made a huge difference on a lot of things. Like,
Right.
a lot of the people were very like, I see a GYN oncologist, and he runs my chemo, he runs my treatments, he runs all my stuff. And I mean, in the beginning, was I like super overwhelmed? Yes, but it's like that point I have cancer. So it's kind of like when I first was going in for surgery, I'm like, oh, I may never see you again. So I kind of kept playing dumb. It's not gonna come true. And then at that point, now I've had surgery, and I'm kind of like, okay, like you can't do
Right.
any different then. And then I just started researching what the treatments were, and it wasn't that it was much of a difference. And
Okay.
then now I've established the relationship, and then from follow-up visits, I've established like quite a relationship with like the staff there and everyone there. And like my own physician, he gave me his cell phone number the day I was diagnosed in the hospital. He's like, if you need anything, he's like, you can text me anytime. So we have a really good like kind of like communicating relationship that I think that maybe if it were to come down to later down the line, if it were to have like, recurrences or something like that, maybe that I would go somewhere else. He's fairly young as well. So I feel that he's gonna stick with me, I think, for quite a while. So that's nice. So yeah, I feel that I do think second opinions are great for, some people. I do feel that if you have to have that with your physician and your team, you have to trust them. You have to have that communication. If you feel that there's like I mean, everybody's different, everybody has different personalities. And if
Right.
you, I mean, in the beginning, I kind of was like, maybe he's not good for my personality, but then we've grown on each other where it's just, you've got to have trust in your team, and
Right.
you've got to be
Right.
able to, kind of trust them that they're not even going to do the best thing for you, but they have your best interest in hand, that
Right.
sometimes they're going to tell you no, and that's because it's in your best interest.
Right, right. And it sounds like you developed a good rapport with your team. And so that's really important.
Yeah.
But thanks for sharing that. We're going to shift over now to the treatment side of things. So just hang on tight.